Start with, I'd like to acknowledge the rightful custodians of the unceded land that I'm joining you from today, the Wurundjeri people of the Kulin Nations. I also acknowledge the rightful custodians of the many lands that people are joining us from today. I pay my respects to elders, past and present, and I extend that respect to any Aboriginal and Torres Strait Islander people here with us today. It always was and it always will be Aboriginal land. So today we're here to celebrate the launch of Rainbow Health Australia's newest guide, the Pride and Prevention Partnership Guide. As I said, today's event is being recorded and will be uploaded with captions. So my name is Belinda O'Connor and I'm the Primary Prevention Coordinator at Rainbow Health Australia. My pronouns are she and her. And this guide that we're here to launch today, it's part of Rainbow Health's work to help support the prevention of family violence that's experienced by LGBTIQ communities. So while there's a long and strong history of such work being done, a formal focus from a primary prevention point of view is newer and emerging and to us very exciting. So our director, Marina Carman, will speak a bit more about this work shortly, introduce the guide and go into it a bit more in depth. So for anyone who's unfamiliar with primary prevention work, it means working to challenge the underlying drivers of violence, to stop violence from happening in the first place, which means changing attitudes, changing institutions, and building a society based on respect where all people can flourish. And for anyone that doesn't know me, I actually started out in formal primary prevention work with the Women's Health Service. So I helped to support the Northern Metropolitan Region's Primary Prevention Partnership. And we had over 20 organisations working together to prevent violence against women in our area. So in a way, for me, primary prevention has always been about working in partnership. That's kind of where I started. That's where I come from. And in that work, I got to see the power of those relationships and the collective impact that we made by making sure that our work was aligned and that we supported each other's. So this new guide today, the Pride and Prevention Partnership Guide, and some of the partnerships connected to it that we'll talk a bit more about later, moves into a kind of new space as it's aiming to support the growing relationships between organisations that work to prevent violence against LGBTIQ communities, as well as organisations working to prevent violence against women. So it's a very exciting time to be in this space. I feel very fortunate to be a part of it. So today we're going to start with introductions from the Minister for Prevention of Family Violence, Spence, and CEO of Safe and Equal, Tania Farha. After that, we'll cut to Marina Carman, who's the Director of Rainbow Health Australia, who will speak about our project, a bit more about the partnerships and the new guide in a bit more depth. Then I'll be joined again by our guest panelists who represent two of our key partnerships and to talk about what it's been like actually putting this work into practice together. So they are Starlady, who's the Program Manager from the Zoe Belle Gender Collective, and Megan Cooper, the Senior Manager of Primary Prevention at Safe and Equal. And we're also going to have Jackson Fairchild, Head of Policy and Programs at Rainbow Health Australia, just to talk about this work from Rainbow Health's perspective and what it's been like working together. So I can't wait to get in today's content and discussion. So without further delay, we'll begin with the introduction from Minister Spence. Thank you.
Hi, I'm Ros Spence, Victoria's Minister for Prevention of Family Violence. Firstly, I'd like to acknowledge the traditional owners of all the lands we're calling in from today. For me, that's the Wurundjeri people of the Kulin Nation. I pay my respects to their elders, both past and present, and to any First Nations people joining us. I also acknowledge victim survivors of family and gendered violence and remember those who have lost their lives. Their lived experience is at the heart of all our efforts to prevent this violence. Thank you to everyone at Rainbow Health Australia for your work to create this important resource we're launching today, the Pride in Prevention Partnership Guide. The Andrews Labor government is committed to our shared mission of creating a state free from family violence, where everyone has the chance to live safely and freely. This means recognising that not everyone experiences violence in the same way, and that family violence often intersects with other factors like gender and sexuality. We realise that rigid and binary ideas about gender and sexuality are a key driver of violence against LGBTIQ+ people. That's why Rainbow Health Australia's Pride in Prevention Partnership Guide is such a valuable resource, both through this guide and the groundbreaking Pride in Prevention Evidence Guide before it. This resource is an outstanding example of what can be achieved when lived experience is heard, considered, and built into prevention work, and those learnings are shared effectively across sectors. The result is a practical, real-world framework to help build the capacity of LGBTIQ+ and family violence practitioners and organisations across Victoria, which will in turn improve how we identify and apply what works to prevent family violence against LGBTIQ+ people and communities. So it gives me great pleasure to support the launch of this resource today. Congratulations to Rainbow Health Australia and everyone involved in bringing this guide to fruition. I wish you every success in this important work, and I look forward to continuing to partner with you to stop family violence across all communities in Victoria. Thank you.
Good afternoon, everyone. I'm pleased to be a part of this launch and sorry I couldn't be there with you in person. My name is Tania Farha and I'm CEO of Safe and Equal, formerly known as Domestic Violence Resource Centre Victoria and Domestic Violence Victoria. We're an independent, non-government organisation and we're the peak body for specialist family violence services for women and children in Victoria. I'd like to begin by acknowledging the traditional custodians of the land on which we're gathering today and pay my respects to elders past and present and thank them for their love and care of the land. I'd also like to recognise that this land has never been ceded and was and always will be Aboriginal land. It's fantastic to be joining you all this afternoon to open this discussion about inclusive partnerships and share learning from Safe and Equal's partnership with Rainbow Health Australia. For Safe and Equal, we know that family violence is prevalent across all of Australia, regardless of background, ethnicity, education, socioeconomic status and career. However, in saying this, we also know that particular communities are targeted for violence, including the LGBTIQ+ community. Safe and Equal is focused on building and enabling prevention work across Victoria, but this needs to be done through an intersectional lens, and we can't do it alone. If we are going to effectively address the ongoing and disproportionate impact of violence on LGBTQI+ communities, our work needs to be informed by collaboration with those communities. An important part of building partnerships with LGBTIQ+ orgs is recognising power imbalances. This is a key step in building positive working relationships that do not reproduce the discrimination and gendered drivers that our work is trying to address in the first place. This is where the story of our partnership with Rainbow Health Australia has become so important. What began as a project-based partnership in 2019 focused on integrating an LGBTIQ+ inclusion lens to prevention workforce capacity, building and coordination, has flourished into a strategic partnership across the breadth of our respective work with a shared vision for an inclusive family violence system. I don't think we would be where we are today without the care and partnership process invested in early on and is reflected upon within the guide being launched today. For Safe and Equal, the partnership has supported our prevention training and approaches to workforce development and influenced our language and knowledge of the shared drivers of violence against women and LGBTIQ+ communities. But mostly, it created a critical friendship that allowed us to question and push each other and learn together. The formal partnership process that underscores our collaboration and is spoken about in this guide has helped us build trusting relationships and embed ways for us to draw on each other for peer support, formal advice and guidance across all areas of work. This process continues to provide us with strong foundations for our partnership to adapt and to grow. Forums like today and documents like this partnership guide provide an opportunity to share learning and inspire ongoing conversations about what an inclusive, intersectional and collaborative approach to ending family and gendered violence can look like. I'm so appreciative of the opportunity to talk to you all today and for our ongoing partnership with Rainbow Health Australia. I look forward to carrying on this conversation in coming months and into the future. I do believe that with the collective commitment, expertise and compassion across movements and the prevention sector, we'll see an inclusive family violence system and create a safer and more equal future for all. Thank you again and good luck.
Thanks very much. As Belle said at the beginning, my name's Marina Carman. I'm the Director of Rainbow Health Australia. I use she, her pronouns, and I'd like to say a very big thanks to Minister Spence and to Tania Farha for their opening remarks that they've provided for our event here today. I would also like to start by acknowledging the traditional owners of the lands on which we're meeting today and pay my respects to elders past and present, always was, always will be Aboriginal land. I also always like to start these talks with paying tribute to the rich history of the feminist movement and the many LGBTIQ activists who have gone before us to allow us to be in this space today talking about these issues. So we're once again very pleased to be here to launch a gorgeous new resource brought to you by the team at Rainbow Health Australia. It was only just 2 years ago that we launched Pride in Prevention, and it's been a year since our follow-up messaging guide. And these really have been resources whose time had come, that gathered together all of the information in one place and gave us the tools and the language to talk about primary prevention for LGBTIQ communities across the various sectors engaged with and interested in this issue. And these resources have been downloaded many, many times, quoted, used in policy documents. And we've been really pleased to be invited to speak, give advice, and participate in many, many productive debates and discussions over the last couple of years. Well, the first two Pride in Prevention resources were a product of the previous phase of the LGBTIQ Family Violence Primary Prevention Project. And we were really pleased late last year to receive a further 3 years of funding through the Office for the Prevention of Family Violence and Coordination. And the main aims of this new phase of the project are to build on existing work to further the reach and impact of LGBTIQ family violence primary prevention interventions and partnerships, to further the prevention workforce further develop the prevention workforce specialised in LGBTIQ primary prevention, and also the integration with broader primary prevention workforce approaches. And also then to develop new Pride in Prevention branded resources to develop and share learnings in key areas. And that includes the partnership guide today. And we're also in the process of embarking on a new one that's looking at evaluation. So looking back at Pride in Prevention, we always made it clear that we didn't start from scratch. We drew on any existing work we could get our hands on, and that included existing research, existing policy frameworks, particularly Change the Story, the National Framework for the Prevention of Violence Against Women, and also an analysis of existing initiatives and interventions. And we realised all along that a lot can be learnt when putting things together in a new way, and we've certainly kept going with that in mind. A key outcome in Pride in Prevention was the development of a proposed model for the drivers of violence experienced by LGBTIQ communities. And a key point was that the drivers of violence for LGBTIQ people overlap with the drivers of violence against women through the interaction of rigid gender norms and their relationship with cisnormativity and heteronormativity. So these common and interlinked drivers mean that the sectors looking at and responding to these issues need to work together. And this includes organisations working in and for LGBTIQ health and wellbeing, equality and rights, and organisations working in and for prevention of violence against women, gender equality, and women's health. And we've taken huge steps forward in building mutually beneficial relationships and collaborations over the last few years based on this model for joint work across these sectors. So in deepening understanding and practice in shared gender transformative work, we felt that there was a gap where we could make a contribution. And we also felt that this resource was important in sharing lessons from the previous project phase in terms of the formal partnership process that we undertook initially with the prevention team at Domestic Violence Resource Centre, that was then broadened to encompass all of the merged peak family violence organisation in Victoria called Safe and Equal. And again, when we started looking into this, we realised there's a lot to be learned from existing theory and practice. And that includes the academic literature, looking at definitions, case studies, key features of effective partnerships and barriers, looking at partnership approaches in other sectors, such as international development, HIV, Aboriginal and Torres Strait Islander health, and also looking at other existing partnership tools and resources from things like the Partnership Brokers Association, Vic Health, and there's also one from VCOS. So I just wanted to take a moment to highlight a few key points in the resource. So the first is that cross-sector partnerships are the key to developing and deepening the collaboration required for gender transformative work. So we need to work out what makes these tick. That this work requires family violence and prevention organisations to take leadership on LGBTIQ experiences and needs, but that this has to be done in a way that lifts up those less powerful and champions the principle of nothing about us without us. That there's a difference between community engagement and co-design, which are essential for the design of interventions and organisational plans for inclusion, and partnership, which is more about focusing on the relationship between organisations and how this can then enhance the work. And lastly, that this all requires defining partnership carefully together and taking an intentional and structured approach in order to really rake in the benefits in an ongoing and long-term way. So an important thing that we took from the academic and practice literature is that a focus on definitions is important, or we risk just using partnership as a buzzword that doesn't really have any meaning. So this definition that we use in the resource captured what we saw as some of the key features of partnership. In the broader literature and various policy frameworks, partnerships often have been put forward as a way of formalising relationships between equals, moving away from donor-recipient relationships or elevating the control and decision-making of marginalised communities. However, especially in these situations, power is a factor that can't be escaped. It has to be acknowledged and needs to remain central in discussions within and about partnerships. And it influences how to talk about the benefits, the risks, and the barriers, as well as how to navigate these in ways that work. So we hope you find this resource useful and enjoy the conversation in the panel today about applying these ideas and approaches in practice. But before I move on, I just need to say a couple of thank yous. First and foremost, to the author team. Each of you made a valued contribution to drafting and refining the resource. And it speaks to authors that come not only from Rainbow Health Australia, but also from Safe and Equal, and our wonderful partnership broker, Yeshe Smith, who in terms of work-life balance might not like me spruiking her services, but she really is fantastic. So, you know, Google her. The next thing I'd like people or organisation I'd like to say thank you to is Safe and Equal for your continued commitment to this process over the years and the really open and fantastic way in which you've approached our partnership. I'd like to say thank you to our designer, Roseanne Burston from Tinderspark, and the illustrators at Thirst Creative. You've done it again with a beautiful resource. We've worked with you before on each of the previous guides, and very much like to pay tribute to your work and contribution. We would, of course, like to thank our funder, the Office for the Prevention of Family Violence and Coordination, and the really great relationships that we have with the staff in that office. And of course, also thanks to Minister Gabrielle Williams, who was the previous minister that we worked with in the first phase, and now Minister Spence, who gave us a wonderful message today. I'd also like to thank the many, many people who gave feedback and made contributions to the guide, and particularly our project consultation group that just continues to be a joy in this project and plays such an important role in the future development of this work. So thank you very much. We hope you enjoy the guide and you find it useful.
Thank you so much, Marina. I'd also like to say thank you to everybody that Marina mentioned, and a particular thanks to Minister Spence and Tania Farha for their messages of support earlier. It's no exaggeration to say that their support for this work is invaluable, and we're so appreciative that they believe in what we're doing and what this work represents. So yeah, I'm now really excited to welcome our guest panelists. So that's Star Lady, Megan and Jackson as they join in. So once they're all here, hi, see Jackson, Megan, and Star Lady. Great, the dream team. I'm going to ask you all to do a quick introduction. So if you could just say your name, your role in org, and your pronouns. And we'll start with you, Star Lady, then Megan, then Jackson.
Hey, yeah, I'm Star Lady. I identify as a queer, trans, feminine woman from a white settler background, and my pronouns are she, her, and hers, and I'm the program manager at the Zoe Belle Gender Collective.
Thank you, Megan.
Hi, everyone. My name's Megan Cooper, and I use she, her pronouns. I am currently the acting executive director for primary prevention at Safe and Equal. Nice to be here.
Thank you. And Jackson.
Hi, my name is Jackson Fairchild. I use they and them pronouns, and I'm the head of policy and programs and the manager of primary LGBTIQ primary prevention project here at Rainbow Health Australia.
Fantastic. And thank you to all of you for being here today. And we've all been very fortunate to work together a little bit, so it feels like a very friendly, lovely panel. Not that our panels are not normally like that. So Jackson, I was actually just going to start with you and ask you if you could give us a little bit of a background on the partnerships that are represented here and the work, and basically how we all came to be here today.
Thanks so much, Belle. Yeah, so partnerships have been at the foundation of this project since its beginning. When we came together and conceived of pride and prevention and the evidence base that underpin this, we realised that the only way to do this work effectively was together. We worked closely to identify with some of our existing partners and allies to identify the key people we needed to be working with to really bridge the gaps and pilot some ways of working and the projects themselves, but the kind of partnership and collaboration approach we needed to use to make that work, because we knew that the relationships were just as valuable as the outputs themselves. Early on in the process, we had some important conversations with some key people. I really want to shout out to Dr. Stephanie Lusby, who's now at Respect Victoria and is still a research fellow here at Archers, who at the time was the Director of Prevention at DVRCV. In our early conversations, we talked about this work and the really important, the strong importance of getting this approach right and making sure that we were able to speak, sort of candidly and honestly towards our shared goals and make sure that we were on the same page. At the time, we were in the middle of our first lockdown. It was all hands on deck and everyone was exhausted and struggling to figure out how we worked over Zoom, how we worked with all these new strangers we'd just met. And a structured approach really helped us begin. It gave us sort of that sense of optimism and a sense of a path to walk together. Steph had done a lot of work in the international space and had seen the model that is identified in the guide used really well, and also knew that working from a position of a larger organization and a smaller organization where there were different positions of power in the relationship, that we needed to get that right. And so she proposed that we use that model to working together. At the same time, we had an existing relationship with Star Lady and the Zoe Belle Gender Collective, where we'd collaborated on a range of different projects over the years. And Star Lady had identified and spoken about work in this space for quite some time. And as an organisation that focused on the prevention of violence against trans people, with a particular focus on, and conversation around violence against trans women and trans misogyny, and the importance of working with men in relationships with trans women, we saw that as a great opportunity to work together. And we decided at the same time to take on a more sort of co-designed approach and to work together to identify how we could work closely. But as two smaller organisations, we had it with existing relationships, we were able to take a little bit more of an informal approach. But there are benefits and sort of strengths and to each approach, and we'll talk a bit more about that as we move forward.
Absolutely. Yeah, I think, very important. It's really interesting the way that we've, it's not a one size fits all, it seems like, in the way that what's worked for the different partners. And following on from that, I was going to ask you, Star Lady, if you could tell us a bit about why it's important that primary prevention organisations partner with organisations like yours.
Well, the ZGBC, we've been advocating for many years around addressing men's violence against trans women. And so this was a really fantastic opportunity to create a resource promoting healthier relationships between trans women broadly, or trans feminine people, and cisgender men. And I do want to acknowledge that that resource and the work that we've done in our partnership is like a real international first. We haven't seen this sort of depth of work occur anywhere in the world. It's really sort of groundbreaking. And it was just also, I guess, in terms, we just haven't seen anybody addressing the violence against, men's violence against trans women. And we were talking about a group of people who experience incredibly high rates of violence, objectification, fetishization, sexual exploitation. And I think while sort of like when we're talking about intersectionality, we've got a history of just talking about it, but not necessarily doing that work. Like, we need to be moving beyond a panel and moving on just about talking about it into resources. Like, where are the campaigns? We have had no campaigns, around addressing, men's violence against trans women. And so I think this was a really great opportunity to be able to do that. Like, organizations have a responsibility to address, inequity. They have a responsibility to work through an intersectional framework. And ZGBC, we've been doing that advocacy. We have the sort of, it's our lived experience, it's our community, it's my friends' lived experience. So we have the connections and the lived experience, and to have that sort of like have the space to be able to professionalize that, to do consultation with our community and engage our community and come up with like, this is how we respond to that violence, this is the campaigns that we need, is really important. We're a small organization, we would never by ourselves have received the sort of funding and support that we needed without the partnerships. Because we're small. Like, ZGBC really only has 2 staff. So I find it a bit funny when Rainbow Health Australia talks about it as a small organization as well, because we're quite sort of tiny. And so I think it's about moving beyond, I guess, performing intersectionality and actually engaging with communities and building them up. Like, you've done such an incredible work with us, like, involving us in the consultation for all of the resources that you've created. We've learned so much about prevention and working in that framework. And so it's given us like an incredible sort of breadth of knowledge, and so has sort of professionalized us within this space. Yeah.
Fantastic. Thank you, Starlady. Yeah, I think, from working with you as well, I think even in that question, why should prevention organizations partner with organizations like Zoe Belle? It's not just a one-way street. We've both learned in both directions, and we've kind of been greater than the sum of our parts. But yeah, it definitely is not a one-way relationship. So we've both all grown and learned together, I think, in that. Thanks, Starlady. Megan, I was going to ask you just to talk a little bit about, we can get into a bit more of the nuts and the bolts of the different kind of approach we had with Safe and Equal, but just in general, how have you found working in that approach? How did it change your attitude or work in partnership work, if different to something you've done before?
Yeah, thanks, Belle. I think probably, I guess probably to say that with the Rainbow Health Partnership, I came into it actually after a point of transition, which I actually think is a valuable learning and reflection also to have about how the partnership has evolved over time. But I think something that I really learned through this partnership, and I'm continuing to just is an important message for me, is that I think something was alluded to earlier, is that you really need more, partnerships need more than good intentions and personal relationships to be successful. They really need intention. I think they really need a good, sound process around them. And I'm not prescribing what that process is. What it is actually needs to look quite different depending on who is involved. It's like a dance, right? The steps you take are going to be different depending on who you're with. But I think that what you need to pay attention to in building that process is both the art and the science. So I think the art is in how are you going to try and build a relationship, get to know each other, understand the context in which they do their work, the risks, opportunities, the very real challenges that I just do not understand. And my position in my organization is I'm not exposed to those, in particular the risks. I think is quite important. So the art is like the active listening. being willing to enter into brave conversations. But I think doing that alongside and giving equal importance to some of the science, the art and the science, right? They go hand in hand. The science is sometimes about the partnership agreement and the importance of that. I think don't underestimate the importance of note-taking and of processes that document how you're going to work together, the expectations you have of each other, who's going to do what, when, and how you're going to review it. And it's okay if you don't follow through on all of that. But if you have a moment to step back and think about, well, why was that? And to query what worked and why maybe you didn't take those steps, being really purposeful in building that process around those relationships, I think is just so fundamental. And in this, I think one learning for me through this partnership is seeing how attention to that process has really helped us through periods of change and transition in our organizations, because we did go through a period of change and transition. I came in at that point of change and transition. And because that process had been built there, it really helped us through that. And I think it really helped us achieve something wonderful, and it's still going. So.
Yeah, absolutely. Thank you. And I mean, for all of us, we've all been through a lot of change. And I think that the work we've put into what contains and supports these partnerships and relationships has seen us through some difficult times, even Jackson, like you said at the beginning, through COVID, the ever-present, hanging in the background. So thanks, Megan. Jackson, I think following on from that, I was going to ask you if maybe picking up on the approach that Megan was talking about, when we worked with Safe and Equal, there's a bit more of a formalized approach. You mentioned a bit more of a pre-existing co-design approach with Star Lady and ZBGC. But could you explain to us a little bit about the partnership brokerage approach and why that was useful in that case?
No, absolutely. Coming into a new relationship, as Marina spoke about earlier and we've touched on already, recognizing power and the different forms of power and the way that those dynamics can interact and influence a relationship is very important. Just as Star Lady just so rightfully pointed out, Rainbow Health itself is in fact a lot better resourced and larger than ZBGC, and simply things like money, scope, access, all of those things, history within a sector, the respect and voice that people may have heard, or even just being the people that hold the dominant knowledge and language that guide the work that everyone does. And in all of our work, with the best intentions, sometimes our frameworks don't always mesh, and there are conversations that need to be had about how to best align and integrate our work together in ways that transform and innovate and don't inadvertently reinforce the very norms and sort of rigid ideas about how the world should be or who we are, or accidentally, without examining our own power, harm people. And I think in good partnerships, you need to be able to speak truth to power, and you need to be able to call each other in a bit and say, hey, that didn't go very well, or I'm wondering about this. But power in the room can sometimes make that difficult to do. Star Lady and I talked about this at the early parts of it, and I said it's really important that we work well together and that you feel like you can speak honestly to us. And how do we do this work together under difficult circumstances in a difficult space? We're able to have those conversations one-on-one. The work we were doing with Safe and Equal were broader groups of people involved in those conversations. We needed someone to come in and use a structured approach and help get us started and build a relationship essentially from scratch. The partnership brokerage approach was a great way of doing that. It meant that we had someone confident and calm who could come in, invite us into our integrity, get us to talk the real talk. Yeshe, shout out to you for being both kind and direct with us and making sure that we talked about our goals and what our hopes and fears were, and found ways of working together effectively despite all the challenges going on around us at the time. And that structured approach helped me feel calm, like knowing what was going to happen when, what the resources are that were required, and also how we would continue to do that work together into the future. It gave a sense of formality, really trying to build the bones of something that would survive just the people involved. And that's a big part of this work. Doing great partnership work happens all the time in so many different spaces because people like each other, they talk to each other, they set good intentions, and they work together well. But in a world where workforces can change, staff can turn over, COVID meant that there was a lot of changes within the sector. We needed to build something between our organisations that went beyond an individual project and instead spoke to collaboration and served as a model for how we would do that. And at one point, when I met Megan for the first time, I remember this great moment where we sat down together and we looked at each other, and you said that you'd read the guide, and your face lit up. And I knew automatically we had a shared language. We had something that we could speak to, something real, and we didn't have to start from scratch. And that was really powerful to me. And it meant that we were able to begin, sort of pick up the work from your predecessor and push forward, really sort of boldly with a set of common assumptions and agreements that were held by our organisational partnership, which was really fantastic. And that's where I think that structured approach really, really helps.
Yeah, thanks, Jackson. Yeah, a lot of valuable stuff in there. And also, I think touching on a lot of what's in the new partnership guide as well. A lot of that is reflected there, but I wanted to pick up on one little aspect of that, and maybe throw to you, Star Lady, but I encourage everyone to have an answer on this one, is about power differentials. Like we've talked about, like, for example, Jackson working with Star Lady, Rainbow Health is a bigger org, but then working with Safe and Equal is the smaller org, and there's all different, we're coming from different sectors, different histories, with shared history as well. So I'm just curious, Star Lady, what do you think about how important it is, or how you would talk about the effect of different power differentials in these partnerships?
Yeah, I think it's really important for organizations, especially larger organizations, to have a really clear conversations with smaller organizations at the start about those power imbalances, and talk about how you're going to overcome them, but also to a commitment to like honest conversation, and making sure that the smaller organization is actually involved in all the decision making and doesn't get cut out, and is informed along the way. Because as a smaller org, you're always really, without the resources that you allocated to us, we would never be able to do this work. And that it actually means that work means a lot to us. Like, trans women have been excluded from the prevention of violence against women for a long time, and it has real impacts, on our lives. And also we have a response, not just we're small, but we have a responsibility to our community, and we're accountable to them. And so, you're really worried about funding loss or about being cut out, and that needs to be acknowledged. And the only way you can do that is by having really sort of like frank and open conversations about those power and differences, and by providing support is really important, and having like a really good and respectful relationship where you can be sort of honest. And there were challenges that came up during the time when we were working together. I think that sort of like transparency, openness about those conversations were things that we would overcome. Like, in particular, there were concerns, like a lot of it around the prevention of violence against trans women is around sex, it's around consent, it's around sexual exploitation. And that was definitely an area that I was really worried that we might be silenced in. And having those conversations and going, well, how can we talk about this, but still using a prevention of violence lens? And that your organization was very open to making sure that we can include consent within this resource, which in many ways can be taboo in the areas of prevention. But that, from an LGBTI perspective and a trans women's perspective in their relationships with cis men, was really fundamental to creating this resource. If we didn't address the sort of sexual exploitation and consent issues, we would have missed a lot of really important information for the trans and gender diverse community.
Yeah, absolutely. Thank you, Star Lady. And I don't know about you, but my personal experience with that trust building and being transparent, and even going up to some of those edgy conversations, I like to say, it's almost like the more you do it, the easier it becomes. That's what I found anyway. Once you realize you can do that, you can keep going with it. So I think we could all sense, not just in this group, I mean, just anyone can sense when that happens. So yeah. Megan, did you add anything? Yeah.
Yeah, I'm resonating so deeply with everything that was said there. And I just wanted to add that I think that, I harp on about this probably a lot, mostly to you and Jackson, sorry for that. It's just like this the purposeful attention to the process, right? I think that a part of that, especially in this experience, shows that being that formal process where we had an external come in to support us in that initial agreement, I think was so helpful, because it really makes sure that everyone is coming ready to have those brave conversations, I think, to be able to discuss the big stuff, like the challenges and the risks, where if you just leave that and you don't talk about it because it can be challenging to get into, then that's where the risks just continue to compound and magnify and snowball, and you are potentially intentionally or unintentionally reinforcing all of those harmful power dynamics and silencing voices, continuing to silence voices, and not recognizing the different positionality and power that we all have. So I think that's really important, but I also think that there's a learning there. I think in what I'm noticing in this work is that I do think we have an incredible in prevention. We are working within an enabling environment in terms of policy and key frameworks that emphasize the importance of partnership. So I think that there is, dare I say, I don't think that there's really often a lack of interest in working in partnership among many that I speak about, but I do think that there is a little bit of a lack of resourcing and knowledge out there, which this guide contributes to, about what it means to do that work well. And I think that's a bit about the knowledge about how to do that well. The Partnership Brokers Association is one approach and does have some really tailored guidance. This guide adds to that. But there is a resourcing factor. It's like making sure that programs can really get the time required to develop the relationships in really meaningful ways and speak with communities, understand the risks, build those relationships from scratch or wherever they're at. Resourcing to seek external support if it's required, because sometimes that external support is really necessary in terms of creating a culture of entering into those conversations with care and safety. Sometimes you need someone to help carry you on that journey, and that's useful. And sometimes resources to actually enable a meaningful participation in that conversation. I mean, I've come from not just my own organization, but previously I'm usually in a position of, I'm working in a larger organization where we have more resources behind us. We have core resourcing to enable me the time to walk into that room. Sometimes community organizations are not backed. They don't have that resourcing, core resourcing. Literally, it can be quite an ask to ask them to participate in a process of building towards a conversation, having a face-to-face brave conversation and workshop. Just the time to be present in it can be a big ask. And if you don't resource the process appropriately, that's where I think the power can get really hidden in the partnership stuff.
I would just, oh, sorry.
No, you go, Starlady.
I would just like back that up as a much smaller organization. We're often always asked to come to the table because everybody wants to cover intersectionality, but we are very rarely resourced to be able to do that. And, as a small organization, it's really hard for us to apply for funding or to be taken seriously in terms of funding. Like, think about the partnerships that you can form with organization and making sure that you're allocating like a serious chunk of funds to be able to work with them to enable us to work within this space. If you don't fund us, we don't get a seat, at the table. And it's more than just like $150 to like go and sit, sit on a panel or community reference group. It's like we need to be able to develop our capacity within this work, and so that means we need to be able to have the time to think about our work, to consult, to research, to read the sort of documents, and people need to be aware of that. Unless you actually fund us and help us build our skills to be able to do this work, there's always going to be that sort of like inequity. And I think also as a small organization, it's not just about building, my team, our team's small, but we've created like a broader trans femme team that does have there's a lot of trans women of color in that group, but none of them are paid to work in prevention of violence or even within the health sector. And so we have to pay them to consult with them, but also to come along to training days and to build their capacity. So you need to be thinking about how are organizations working with community to build up their skills, and then all of those, trans women will also be able to go, maybe apply for jobs, get a work. How many, in terms of prevention of violence, organizations actually employ trans women? we need to see, and the only way we'll do this if we build people's skills. But our community has really big barriers to both education and to employment. And so you've got to be thinking about things in terms of community development within this work.
I want to stand up and applaud you, Star Lady, and I want to say, on top of that, one of the things that I got out of this work is don't approach this partnership works as though you're just, we need to do the work of opening doors and sharing our power and sharing our access and sharing resources, but we also need to open ourselves up to learning. I'm reminded of a recent forum, last year, I was in a forum hosted by the Prevention Hub by Our Watch, talking about masculinities and working with men through an intersectional approach. And the Aboriginal women from Tarngera in Central Australia talked about the importance of, don't come in here trying to save us, come in here because we know what we're doing. And working alongside Star Lady and ZBGC, they are one of the most capable, insightful and innovative group of prevention operators I've ever had the pleasure of working with, or in fact, on any project. I think TransFem is one of the best projects I've ever had the privilege of being a part of. And the launch was such an incredible example of a community-led launch driven by trans women for trans women that included the voices of the men in relationship with them, to really speak to the drivers, to follow the best practice in prevention, and to say that intersectionality is not about including people who have been left out. It's about saying that power in our society is a complex web, and we need to all work together across those intersections collectively to achieve the mutual impact that's required to create change. And without the efforts and support of trans women, I don't believe that this work of PVOR is possible. And I don't believe that, and I believe this every day, and I've gotten a lot more bolshy with the way I say this, you cannot do the work of addressing rigid gender norms or gender inequality without including people like the trans community and the LGBTIQ community more broadly, who are experts in challenging and achieving rights in an unfair world, who transform gender on a daily basis, and who understand gender because they're not as the process of reinventing ourselves within that structure is one that requires an enormous amount of courage and embodiment in order to achieve. And those voices are critical. And if we want to work with men around their relationships to themselves and their own emotions and self, we have to have conversations around homophobia. And partnerships, I believe, are key to creating the alliances that are necessary in order to get there.
Fabulous. Did anyone want to add anything more on that note?
One more thing.
Yeah, please.
Just furiously agreeing with all and just inspired here, but I really agree. And I just wanted to tap into, I think one of the things that one of the best partnership things I've also ever been involved in was, I think it's really important to look at this idea. Jackson and Star Lady, you both spoke about it, was this idea about looking at the different contributions that the partners have to bring. And I think often it's kind of in the partnership process, the power is often seen as the bigger organization, the one who has access to all the resources, the one who holds the pen to paper. And there's definitely a power in that. I'm not suggesting in any way that we just skirt around that. But I also think that we need to surface and bring some visibility to other contributions that can be made from the organizations that we're working in, and really purposely mapping that out, I think, is incredibly important. And why I think that's important is because, especially for a larger organization, I think you need to enter partnerships with a real purposeful intent of thinking, where do you step forward, stand with, and step back? And I think if you can bring visibility to the contributions that each of you make in terms of your knowledge, your access, your expertise, really acknowledging that, I think I need to be, like, as an organization or as a larger organization, need to be elevating and saying, actually, there is expertise in these community organizations. How do I know that? We're having these conversations. I think there is information and knowledge already out there, like TransFem, that already illustrates that expertise exists. But in a partnership space, it's a really useful way to be able to say, what is the expertise that you think you bring in this space into the work that we're doing together? What do you want to have elevated? And then a partnership is a way of enabling that to become more visible. I like that, the use of that terminology of really purposely thinking about where you step forward and can elevate, but where do I stand in solidarity, but also where do I just step back? And I need to actually create an opportunity for those other voices to come through. I think I just wanted to say, I think that's a really useful exercise to do in a partnership, to really dispel the different, or to open up an idea of the different contributions that we all have to make, and where we can be elevating and amplifying the different forms of expertise and knowledge and power that exists. Yeah,
absolutely. And I might just keep on you for a second, Megan, and pick up on that a little bit. I love what you said about, it's not just black and white, the way the power works between organizations. It's not just size and resourcing, or like you said, that is important. And I'm just curious if you could say a little bit more about being a larger organization, but also being an organization with roots in the kind of prevention of men's violence against women and family violence space, working with an LGBTIQ focused organization. What were kind of considerations, concerns, exciting opportunities that you found in that, and whatever came with that kind of power differentials that might be there?
Yeah, thanks, Belle. So I think a couple of things here. I think, inherently, I think it's, we're a larger organization, but we're also, a peak body. And I think a part of that is definitely significant in how I answer this question, because we do have that approach to we work very collaboratively inherently with our membership and with our various different stakeholders. So that's kind of in our blood, I feel like it's in our blood, it's in our way of working. But I think something that we're constantly assessing and thinking about, which is just about that really purposeful intent. And I think we learned a lot through this partnership, to come back to that, is about how you enter a conversation about if you're going to partner and to what end, and really asking those partners up front, is it valuable for you to do this work, and being able to actually step back from the work and say, this actually maybe isn't the place that we need to be, or if it's not valuable for you to do it, then that's okay, and maybe it's time to step back from the work. Like, having those assessments, I think, is incredibly important. And something we learned through this partnership was, I think, the value of the steps that you take to form relationships, especially from scratch, and the attention to those steps and those considerations along the way, not just kind of jumping into the conversations. And we've applied that real purposeful intention in forming different partnerships in many different ways, not only through a very structured process of partnership brokerage like we did with Rainbow Health, but more just, I think, in the way that we engage with organizations and manage our relationships. I think there's a real deep purposeful intent that we're kind of bringing in this way, and recognizing we need to do that when we're trying to bring, we work across the continuum of prevention, which is a broad spectrum of work, and there is a lot of work to be done there. So I think when we're bringing different stakeholders to the table that are all coming from potentially different areas of work, it's really important to make sure that we're purposeful and bringing really clear on what we're trying to achieve when we're getting everybody in the room together into a common conversation.
Can I just follow on from that, Megan? Yeah. I just really want to acknowledge, I think, we love to disrupt a binary in our work, it's really important to talk about power, but I also really want to acknowledge the work that women's organisations have done in building up this sector, and the incredible importance of a focus on preventing men's violence against women. One of the challenges that we've faced throughout this work has been a sort of false dichotomy, that the prevention of violence against women and the prevention of other forms of violence, that one might dilute the other somehow, and that we need to, that there's a limited amount of resources or space or voice available for us to share. This project has been an amazing example of what happens when we come together and say, actually, we're all facing a world where gender inequality exists. We're all facing a world where there's rigid ideas about our bodies, our relationships, who we are. We've seen incredible, awful attacks on women's rights in America that have exemplified a global populist backlash that is concerning for all of us. And we've seen a terrible attack on trans women in recent times across the world, and trans people, trans young people in particular, but trans women have been of a particular target. And we've seen some incredible opportunities to stand together. And instead of saying, where do we fit in with each other, but instead say, how can we do this work separately? And when working through the lens and the social justice models that we've all been applying, we're all afraid of getting it wrong. It's one of the principles of the training and the work that we do. There's a power that comes from being the person in the relationship, and I can say this as the person who was involved in all the conversations with Safe and Equal. There was a power in being a person coming to the table and saying, please include us, because we had a certain amount of sort of principled and social justice principles standing behind us. And there was such care and intent, but the relationship and the agreement that we had meant that we didn't have to worry about what would happen if something went wrong, or we dropped a ball or misunderstood each other somehow. Instead, there was, let's get excited about moving through these things and trusting each other better at every step, which is exactly what happened. And I'm really grateful for that courage.
Yeah, same. I remember actually a couple of lines in the agreement that I think really reflected that intent very early on. And I think it was incredibly useful to make sure that it was I think what that partnership really did is actually enabled us to steer into and lean on each other in supporting that tricky terrain that you're talking about, those common, like that context that we were both entering into, but in a way that didn't shift the burden of it on to you. We were very cognizant of that and spoke a lot about that we didn't want to, shift the burden of all of that work onto you. And then with all of the work also that Rainbow Health was carrying as well. And it was, it just really brought it to think about a level of care and how that we did the work. And it's just kind of continuing to trickle into what we're doing in this new iteration of what we're looking to do together, not just in the prevention space, but.
And what was so great is that Yeshe always said to us, let's support each other to be direct and not treat each other like we're made of glass. And let niceness be the enemy of, robust, shared work. And Star Lady has been one of my great teachers in that space. As a partner to our organisation, we've always been able to trust Star Lady to keep us honest, keep us on track, let us know when we've had a blind spot or made a mistake, but to always do so in a way that allows that two-way communication and an opportunity to grow and work together. And smaller organisations like Star Lady and ZBGC have a lot to teach us about that approach. I think it's embedded within the model, but I think it's often that approach has actually been innovated by the very small organisations themselves. So it's sort of an interesting ecosystem that we're working, and I learned from each project as we were working together, and those things fed into each other as we move forward, as I know that was the same for you, Belle, and for Marina and Sharmini throughout those conversations.
Absolutely. And Starlady, I was going to ask you, and I think it flows really well from what we were just saying, is what advice, or for thinking about working with larger organisations, particularly who are working on prevention of violence against women, if looking to partner with ZBGC or a similar org, what kind of advice would you give, either what you've learned through this project or just from your extreme wealth of knowledge that you have from all the other work you do?
I think in terms of funding, you've got to resource the organizations that you're working with, and whether that's in your own funding or that you apply for external funding to be able to do that, I think is incredibly important, because otherwise we actually can't do that work with you. It becomes a really big sort of drain on our resources. But I think reflecting upon really the relationship that we had with Rainbow Health Australia and some of the things that sort of helped us, that might, was the training opportunities that you provide. Remember, we haven't come from being professionals within the sort of prevention of violence space. You provided training opportunities. You provided community of practices. They were really sort of practical based supports. The other supports that you provide was, Belle, you were one of the editors, the major editors, on TransFem, and that having an editor who came from the sector was really important. And sometimes it was just subtle shifts in language that really sort of helped make the resource as sharp as it is. There was also both you and Jackson provided regular catch-ups to talk about some of the barriers or some of the challenges that we had. As a part of TransFem, we were interviewing cis men, and there were certainly challenges in that of how the line between how do I create safety so that you're open and disclosing that, but how do I not collude with some of the behaviors that you're enacting that are harming trans women? And that was a really sort of big challenge, and you gave some really sort of fantastic support over that. I also think there was you gave us a lot of freedom, and you not that sort of hyper vigilant micromanaging. You allowed us to create content, and sometimes that content or the resource went in a different direction based upon the community consultation that we're doing. Organizations need to know that, like, a lot of this is new. There's not necessarily the research behind some of these sort of like issues. Like, there's not the research behind what, you know, what's driving the violence towards you know, trans women, and how is that violence playing out. And so the only way we're be able to overcome some of that is around community consultation. And community consultation is like allowing in the budget that we paid people to consult. We paid the people that we interviewed. And also then when we did it, we can't just make up the solutions. You know, we need to consult both with LGBTI organizations, but we also needed to consult with mainstream, you know, prevention of violence services or gender equity services. And then we came up with something we need to take back that to community. That's a really sort of lengthy process that needs to be empowered and it needs to be supported. But there's also risk to us if we get it wrong in terms of community, and people need to understand that sort of like tension or the worries. Like, this is our community. If I get it wrong, I'm responsible to the community, and that community, they're my friends, they're my family. And so there is like an incredible risk. And also this is like our lived experience. And so it was also about providing, you know, in those sort of regular catch-ups, the checking, how are you going? How is that feeling? That's part of your own lived experience. I just want to check it within you. Are you going okay? Is that stressful? You know, because, you know, sometimes we're also interviewing people that we knew. How, you know, how is that feeling? Carrying the weight, you know, of that, of what you're learning, knowing that this is sort of an innovative, groundbreaking project. That's a lot to carry. Providing that the sort of wraparound supports to people who, you know, in doing that work is really important. That's some of the advice that I'd offer.
Yeah, fantastic. I've been all of that, but I think the resourcing part has come through and connects back to something you were saying earlier, Megan, that similarly, that power isn't just about size and resourcing isn't just about money, although it's very important. It's definitely saying it's important, but it can be, I think sometimes we can, I think in both partnerships and relationships, we've also tried to make enough space to be human in it as well, that we can actually support each other. I think we've all developed close relationships, and that this work is, like you said, Starlady, connected to lived experience. It's not all theoretical at all. So Jackson, I was going to ask you, kind of in this vein, what was some of the most helpful things that Safe and Equal did to support you and your work?
Oh, so many examples. The first one that comes to mind is, you know, it was moving beyond thinking about what happened outside of the primary product. We were reviewing each other's training to make sure that they spoke to each other and they were aligned, you know, and we were giving feedback and supporting and developing shared language so that our work spoke to each other and was mutually reinforcing. That was the big bit of what we were doing. But there were other things that came out of that. And I remember one point where, for example, there was a conversation happening in a policy space, and I'm going to shout out to Krista, the Director of Prevention, who was, you know, Steph was filling in for Krista while she was on parenting leave, but Krista, you know, when we connected, did such a great job of championing us at a policy level. And there was one key point in a conversation where I wasn't at the table, and it was just one of those accidental oversights because we hadn't been invited into that space yet around a key piece of workforce capacity reform. And Krista, you know, paused a conversation and said, I prefer to continue this conversation with our partner in this space, who'd be the best person to be able to inform it, which is exactly what happened. And the outcome of that conversation was really fruitful. Little things like that, which are actually quite big, just putting, you know, recognizing that you both can amplify that person's voice. I often quote Starlady in conversation, but knowing, you know, Safe and Equal have been really good at pausing and going, actually, we do need to check this one. This is one we need to ask about. We don't have a precedent or an understanding around how we do that. Has been fantastic. One of the things that Safe and Equal did that was also really fantastic was throughout the process, you know, they worked with us to really represent some of the conceptual challenges of integrating the work and the language from across the sector so that we could address those tricky things and come up with the ways of speaking that support us to work together and get around some of the misconceptions or assumptions that can sometimes block us from seeing actually that this is shared work, not separate work, in a way that actually really preserves the focus on both LGBTIQ communities and on women and men's violence against women, and enhances and deepens that. And those conversations, you know, were part of the training, but they were also outside of the training. They were about policy. They were about how we, you know, describe the work in the strategies and plans that we use, around how we collaborate and develop products. And then when we said, you know, that we wanted to talk about this partnership here today, even just that, you know, the contribution and you know, Megan and Yeshe and the whole team at Safe and Equal, and before that DVRCV, that they made to us, speaking to this approach, and you know, that Megan has such, you know, has come in with such a depth of experience yourself around partnerships and around this approach, means that we were able to develop this resource and even have this conversation, which feels like the capstone, well, not the capstone, but a key checkpoint along the way that we couldn't have achieved without Safe and Equal's backing and courage. And I was just thinking about you know, all the different spaces and opportunities that we've been invited into throughout this process, and then that partnership going beyond us. So this is what's happened now, is that the partnership has joined between us, and there's now more, and it's not my place to speak about it, but there's been more and more collaboration and conversation between Safe and Equal and ZBGC and other organisations around this work. Our partnerships become not just about two organisations working together, but about a network of people working together to achieve collective impact. And I'm hoping that will continue to grow and cross-pollinate, I guess, as we move forward.
I'd just like to back that, Jackson, in terms of like the platform that this has given us to the government, but also across multiple different sectors, the family violence sector, the LGBTI sector, prevention of violence or gender equity sector, but also now we're beginning conversations with the sexual assault sector, you know, as well. And some of those relationships we had before but have grown, but a lot of them are like new relationships, and we're having conversations in spaces that we hadn't before, and forming sort of like ongoing partnerships. Because I guess another bit part of this work is it's not just a one-off. Like, we've created one resource, you know, around addressing these particular issues that's really targeted, like TransFem is just targeted for trans women and to cis men who date it. But there is much broader work. Like, the only way that the sort of violence against trans women is going to end is on a societal wide issue. And this is where we need both LGBTI services and prevention of violence services, because we're small, we're tiny. We need everybody doing that work and collaborating together. And I think it was when we did the trans research into trans women, many of the drivers of violence against trans women were the same. The outcomes were the same as that of cis women. When you're thinking about the pressure in terms of like rigid gender roles and stereotypes impacted both trans women and cis women. Sometimes I felt like for trans women, they were exuberated, like the pressure to be hyper feminine, or some, you know, the control of over trans women's bodies. But there's issues that cis women face as well. And so that the work that's been done, I think, and when we think recently, when we've had these significant attacks on trans women that were driven around their election, around sports, and we look at the responses, actually, the prevention of violence services and gender equity services were often able to better respond to that sort of like the trans misogyny that was going on than some of the LGBTI services, because of their work in gender equity and knowing how to deal with these issues. And they spoke about it very articulate. Maybe they didn't necessarily have the confidence, or they were nervous, it was tentative, but their work on it was really sort of, you know, outstanding. It was extraordinary. And I think we need to see that more, because especially for when we're like trans women in particular are under attack right now. It's like, you know, these incredible drivers of violence against our community. We need other people to step up. It's traumatizing when your community is under attack, like, you know, in terms of like the violence that's happening against our community, but also its impacts on mental health. And we can't necessarily, when we're under that much attack and pressure, come up with all the solutions. We need other people to feel empowered to already have done the work and be confident in being able to address that violence when it occurs.
Can I just shout out to that and jump in as well, Starlee? I think something that is coming up for me here too is it feels a little bit like this conversation in and of itself is almost like a little bit of a demonstration of the outcome of the intention that was put in the care. I think you gave some really beautiful examples, Starlee, earlier of your encounter with Rainbow Health, and I thought they are really tangible and fantastic examples that illustrate care in the approach. That's like the art, you know, the science and being perfect about that. But yeah, this is just, it makes me think that it shows this conversation and what you're speaking about right now is showing an outcome of our respective partnerships in and of itself. The partnership as an outcome, as a result of the work itself, is actually really useful for what we need in this work going forward. And it's not just the project-based stuff. Like when I think about, you know, one of my first encounters with Jackson, where after we had met and I thought, ooh, and can I call them? I'm really stumped, and I was new to the sector, and I just thought, okay, I'm in a situation at the time where I'm feeling like this encounter in a policy moment is just not sitting right with me. I'm feeling like it's not all right. And I called them, and we called them about it. So my colleague, my former colleague, we called them about it because we just said, this doesn't feel right. That peer support, that ability to pick up the phone and have an ally and to talk about that stuff isn't nothing, you know. It's a small example of what is actually a bigger outcome and a fantastic result of what is actually about connection in the sector, and a sector actually working well together, communicating well together, and our efforts are more connected. They're not siloed, they are more aligned. So I think if you really do, like we've spoken a lot about, you know, purposeful intention to process and proper resourcing for the work to be done, and for that really enables community voice to be heard. It's just making me think that if you do that well, these conversations are just a great demonstration of what the outcome can be, which is better collaboration, better communication, and in turn, hopefully more alignment of the work that we do, and then better outcomes for the communities we're trying to affect change in. Sorry, Belle, did I just totally take over your role?
No, the role is for everyone to chat. And yeah, I think like listening to all of you speak on that as well, I think obviously we are highlighting and speaking about particular partnerships that we have here, but I love that everybody's touched on, we are just a microcosm of the bigger sector, field and space and community. Like there's a lot going on here, and we are not the only part of it. And so to hearing those further connections and how it's spreading out. And I guess the question for all of you is, going through these partnership processes that we have, has it also changed the way you've done partnership work or relationship work with other organizations in other, like, has this been flowing out for you? I mean, you've all touched on it a little bit, but yeah, has it, do you think you'll do things differently from now on, I guess is the question.
I mean, for us, like for the ZGBC, it's just really great to be able to have like this particular resource, because it'll help us give it to our partners, because we're often the ones without the sort of power and when it goes wrong, it can really go wrong for us, and we can often really lose out. And then it can be like, it's hard once a partnership sours. For us as a small organization, it's really hard to challenge. Like sometimes you just have to walk away, and you sort of like, it's a real sort of loss and drain, you know, on your organization. So just having this resource to be able to go, I really want you to read this, and I want you to understand how this, you know, to work in a partnership, and how it can be transformative, and to ensure that you address the sort of imbalances of power that sort of like exist, you know, that were for us. And for us, I mean, this project has just given us that platform to work with other organizations, but also probably gives them the resources. They might be worried about those sort of empowerment balances, especially with smaller community-led organizations.
Yeah, and ditto to all of that. I mean, I use this way of thinking, and the very way I think about partnerships and about power sharing and working together has been changed by this work. And I come from a background trained as a therapist, I've worked as a facilitator, I've run groups, I've run organizations, but this work of really intentionally speaking to partnership and the model and the kind of way in which Yeshe modeled, you know, honest and bold, real conversations towards a shared goal, really helped me be braver and helped me speak in a more authentic way and to be more present in conversation with community partners and to both offer and receive support better, to not just see myself as someone who's helping other people, but also recognize that I need help and support and input from them, for that to be reciprocal and equal and mutually nourishing. And that requires the courage to trust each other with big requests, big statements, or small ones, and to notice in ourselves our tendency, despite the fact that all of us are dedicated towards structural transformation and you know, changing things about the world that people don't want to hear about at the Christmas table, we sometimes struggle to give that same level of care and attention between the relationships we have with each other. And this model's really supported me to deepen that.
Yeah, just hear an absolute ditto. That was nothing more to add. I think probably, you know, for me personally, I had done partnership work before coming to this role, but I think that from the guidance, from the experience in this partnership, is I think I've learned a whole new level of what it means to be kind but avoid being nice, and how to do that within a framework of care and understanding so that we can have difficult conversations, but we come to them with a sense of kindness and generosity and openness, but also not just not trying to be what it means to not have an extractive relationship. I think those conversations have been pretty profound, and personally I think it's definitely affected my practice there. And I just think there's so much in this guide that will hopefully be able to catalyze just ongoing conversations in the sector about other models and how other people are working together. I know there is so much work that's already out there and other partnerships that are ongoing, like the regional health partnerships are quite a significant one there in the prevention space. And I think this guide will just be another great addition to the learning out there that's in the sector, and how we can really purposefully have some more discussions about partnership and what it looks like, and how to, I don't want to say how it do it well, but just how the journey has looked for you and what learning you have taken from them.
And I just want to give a shout out to the Rainbow Health team, because like nobody has supported us, like honestly, to the level and depth that you have. We've been advocating for, you know, to addressing the violence against trans women by cis men for decades. And I'm not just speaking from my own self, but from all the trans women that we have worked with, that we have interviewed. This means a lot to our community. And you worked with us in such an incredibly respectful way. We are very different organizations, incredibly different. You're a research, you know, really coming from a research organization. We are a fierce community advocacy group. There are really big differences in how we operate, but despite that, you saw that we had sort of like unique sort of skills, insights, and understanding. You understood that there would probably be risk for you in working with us, because we are like quite a sort of like radical, you know, fierce advocacy group, but you supported us because you believe you saw that there was a gap and that our community needed support, and you committed to that relationship in a really kind and open way. And we have never had the level of support. We would never have been able to produce this resource or address, I think, you know, TransFem is really providing insight for the entire sector, multiple different sectors, on the insights to what is driving the violence against trans women and how that is addressed on an international level. And you gave us that opportunity. So I really just want to say thank you, and that your team's fantastic.
Thanks, Star Lady. I promise we did not put on this event just to have Star Lady praise us. It's a lovely thing to say. We're kind of coming to the end of our time with the panel. So I think I'd like to end on a bit of a note of where we go to from here and looking to the future. I think, as you've all touched on, I think built on the, I also definitely want to acknowledge like how much partnership work has come before us as well. We're definitely not saying this is the first time this has ever happened. Like you said, Megan, we're just kind of contributing our next bit of a bigger journey across all of our sectors, I think. But with that said, yeah, maybe Jackson, I'll ask you, where do you see the future of this work going? Easy question.
No, I've got two answers. One draws from what Megan just said, and the other draws from what Starlady just said. At the beginning, this has been work about one-on-one work and how we can work, and how those one-on-one relationships grow and how they interact with each other and build an ecosystem. The work that women's health organisations have done in the regional partnerships to build through planning and evaluation and evidence building and looking at collective impact has been extraordinary. And I'm really looking forward to exploring how those approaches can be used to support the LGBTIQ organisations who often work with very little resources and very difficult circumstances to transform the fabric of society, to build and grow their own mechanisms for cross-collaboration and collective impact that supports sustainability and effectiveness, that builds a sector that can really take everything it is so amazing at. The LGBTIQ sector, I've said this 1,000 times in these events, no one does messaging, branding, community engagement, resource development, naming hard things and transforming gender and achieving equality. Like, we are very good at all of those things. We need but what we haven't had the support is, we could really benefit from a deeper understanding of planning for and responding to resistance and backlash, and working more collectively through a more structured approach to aim for, achieve, measure, and replicate change at scale. And those things are things that we could really learn. And I'm hoping particularly to look at how those partnerships at a larger level work. And the next thing I'm going to say is the future of this work is fund trans women to do this work. You can't do it without them.
Thanks, Jackson. Megan and Starlady, for you as well, anything final you would like to add, or particularly about, where you see the future of this work?
I'm really looking forward to, greater collaborations between the trans and gender diverse community and the prevention of violence, and gender equity sector. I think there's a lot that we can really learn from each other, and in different sorts of skills, but also messaging. And so I think those collaborations and building upon those relationships, not just with the ZGBC, there are many different trans and gender diverse and LGBTI organizations, and so broadening out those relationships and really sort of like building the collaborations that are needed. Our movements we need to be working together much more strongly, much more closely. Yeah. And so I want to see that sort of like commitment, over time, and, the opportunities that we have to learn from the prevention of violence sector within the LGBTI sector. I don't think the LGBTI sector is really developing its capacity to work within a sort of prevention lens. For too long, we've just been sort of like looking at the impacts of violence and sort of like immediate like health responses, health and well-being responses, but actually we need to, be driving that sort of social change.
Yeah, just ditto. And I think I want to pick up on something I really see as a potential in this is, the possibility of this being scaled. Like, I think we're getting into the terrain now for me, which is a bit about movements. It's about building movements for change and about how those movements respect the different journeys that they are all on, but how we actually see them, our roles as inherently interconnected and where they can be mutually reinforcing. But I do think that an important part for me is just, I'm a broken record, coming back to that resourcing piece. I really do think that underpins the ability to actually do it. You can't have those movements intersecting and working together. You can't have them built unless they are properly resourced to engage in the relationship building, unless they're properly resourced to actually have those conversations and come to the table. And I'm also very mindful that, as a larger organization, that finger's coming back in my own direction, not just outward too. So I'm just acknowledging that, but I think that that's where I see the future of the work, where we really antagonize and get to the root of the resources that enables that movement building in our respective spaces and collectively, because I do see one as supporting another. So.
Oh, thanks everyone. This has been such a lovely and fantastic conversation to be a part of. And I think, having been involved with this work through these partnerships and over time, it's just been a real privilege to work with all of you in the different capacities, in the ways we've all moved around, and yeah, just seeing the way that this partnership work and the project works we've been doing have, like, what's changed over the last couple of years is just staggering, considering as well that it's been COVID. So thank you so much for your work. Thank you so much for being on this panel today. Thank you for your great contributions. And I'm going
to just offer another thank you there.
Yeah, please.
Thank you to Belle, who has worked on multiple sides of this equation. As we say, Belle has worked on every side of this project at different times, and we're really grateful to Belle. And I also want to shout out to our quiet and unassuming director, Marina, Carman, for all of your leadership in making sure that we achieve this vision. It's been an incredible project, and we're all very grateful for everything you've done. Thank you.
Absolutely. And thanks also to the rest of all of our other team members, staff members, organizational, like, we are just the little tip of the iceberg of this conversation. There's so many people who've supported this work, and everyone who's listening today and has been supporting this work more broadly. It has been amazing to see that generosity and that goodwill and helping us build that momentum. So thank you everyone as well. So I might say goodbye to the panelists now, and I'll talk to you all later. And so for everyone else, we'll close up the event today. So yeah, on behalf of Rainbow Health Australia, I'd really like to thank all of our panelists for their time and their generosity. For everyone that's joined us here today, especially, this far into being on Zoom all the time and Zoom fatigue. So great to see how many numbers we had. Like I said at the beginning, a recording of this event will be made available shortly. It will be captioned. We had a little sound issue with one of the videos that will be corrected. So you'll be able to watch a smooth, nice captioned version, hopefully in the next week or so. So the resource is live. Hopefully you can all access it, and we encourage you to share it widely. And hopefully it helps support your work. So thank you again so much for today, and I hope you all have a great afternoon.